The event will begin in 1 minute.
Good afternoon. It is November 23rd. Oops, sorry, I just lost my notes. Hi, I'm Liz Krueger. I don't need a note for that. I'm the state senator here on the east side of Manhattan. And today we are continuing our series of town hall discussions with experts who are helping us wind our way through and survive the pandemic. And yes, we know it's November and we're all really tired of this pandemic, but it's not gone yet. And in fact, we have to be more vigilant than ever, even though the light heading towards us at the end of the tunnel, we think is a vaccine, not a train aimed at us. So we just have to be strong and smart and stay healthy a few months longer so that we can all get ourselves these new vaccinations. Before I start today's proceeding, I want you to be aware that we have closed captioning. So if you're watching this through Zoom or Facebook, you can turn on the closed captioning and read along if you have issues with hearing correctly or understanding things clearly over the computer. You have to activate the closed captioning in order to see the text. If you're in Zoom, click on closed caption CC in the meeting controls to start viewing closed captioning. If you're on the Facebook Live event, you'll see a setting button in the bottom right-hand corner of the video. Click closed caption CC to start viewing the closed captioning event. We have important information to share with you today, so let's get right to our program. New York City is experiencing an uptick in COVID-19 cases. In fact, the whole state is. So a growth in cases, a growth in hospitalizations, and unfortunately a growth in fatalities in the 5 boroughs. The governor announced earlier today that Upper Manhattan, just north of my district, is going to become a yellow zone. I'll be providing additional details as they become available day by day. And for those of you who don't know that we're sending out by email COVID-related updates whenever there's something important to share with you, please check on my website to sign up for them or call my office, and we'll make sure that you are getting these email updates as well. We're very fortunate today to have 2 of the best public health officials in the city to talk to us about the course of the virus and to share best practices to manage community transmission, especially since we're facing Thanksgiving in the next couple of days. We've had both of these guests on before, so I'm delighted that they were able to join us again. I would like to welcome Dr. Demetre Daskalakis, Deputy Commissioner, Division of Disease Control at the New York City Department of Health and Mental Hygiene, and Dr. Ted Long, Senior Vice President, Ambulatory Care and Executive Director of the Test and Trace Corps at New York City Health and Hospitals. I want to congratulate Dr. Daskalakis on his recent appointment at the Center for Disease Control's Director of the Division of HIV/AIDS Prevention at the National Center for HIV/AIDS, Viral Hepatitis, STD and TB Prevention. Wow, that won't even fit on one card. They'll have to give him a couple. As New Yorkers, we are sad to see him leave our city and the work here. But as Americans, we are very fortunate that he will be able to bring his expertise to the nation. Now it is my pleasure to introduce Dr. Daskalakis and Dr. Long. After they make their presentation, we will go back to a Q&A moderated by me, and I will come back on screen. Doctors, the show is yours. Thank you.
Great. Thank you so much, Senator Krueger. So I'll share my screen, which will take 1 second, and we will dive right onto the presentation. And so Dr. Long and I will do this as we always do it, as a team. So Ted, I'm going to start, and if you have anything you would like to add, please feel free. So I want to thank you, Senator Krueger, for hosting this, and we're excited to be here to share some information, some strategies for keeping safe, as well as take some of what will likely be excellent questions. So first, I'll start by showing that we have a clear recent trend in New York City that shows that we have increasing cases as well as percent positivity throughout the city. I will start by showing them this map, which is also available on the New York City Department of Health website, that shows the 7-day percent positivity in the city. And you can see that the entire city is starting to show a blush. Some areas darker blush than others. The darker the color, the higher the percent positivity. The graph that we have here shows cases, case numbers, so not a percentage, but the number of cases we have in the jurisdiction by day. And you can see that except for the shaded region where the data are still incomplete, that there continues to be a trend up in terms of cases. So I think this is an important time that as we see increasing disease activity in New York City, we have the tools at hand to be able to drive these numbers down now, so we can prevent a larger peak and ongoing increases in activity throughout the city. So we'll talk in a lot of detail about how that can be achieved. So usually when you see cases increase, the next thing that you expect is increases in hospitalization. Now, this is another really important area of intervention, because if we can do things to reduce cases, and those things are the core 4 plus testing that we always talk about. So that's wear a face covering, maintain 6 feet distance, wash your hands, and stay at home if you're sick, along with getting tested and answering the call from the Test and Trace Corps. If we can reduce the number of cases, we can reduce the trends that we're seeing in hospitalizations and avoid a number of people getting sick, getting hospitalized, and potentially having worse outcomes from COVID-19. So we know a lot about how and where transmission is likely to occur. This is a lot different than in March, when we were just learning about this virus. So although we are still learning about it, I think we have learned a lot more and know a lot more. So we know that there are places where transmission can occur. Household transmission is very common. Indoor transmission without masks, so especially places with large gatherings, look to be associated with increased transmission. In general, whether indoors or outdoors, not wearing a mask in general is associated with transmission. Places where 6 feet can't be maintained. So if you imagine a workplace where you're able to make plenty of room until you get to the break room where folks may be sitting down, taking their masks off to eat and drink. So that could be an area where distance may not be maintained, and also scenarios with vocal projection. So with singing, screaming, etc. So that apparently is a more efficient way for the particles that carry the virus to travel. So what the city is doing. This has been a massive effort from every agency in New York City, and really revolves around work in a lot of different buckets. So the first is massive increases in testing and testing infrastructure. That means really increased access to testing, so more places to get tested, and also new ideas like microsites that involve community-based organizations that will hand a kit that people are able to collect on their own that then gets mailed to a lab. So not even requiring like a clinical kind of place, like a place to see a doctor, just to get the testing. the offer of new testing at major transit hubs like JFK, LaGuardia. I think also we have testing in the Staten Island ferry terminal on the Staten Island side. So really amazing. Also these new ice cream truck or mobile trucks that are around that will ensure flexibility of the testing program to be able to go out and test folks all over the city. A lot of work has happened to reduce turnaround time of the tests. So people may remember there was a time where the turnaround for testing was over 7 days in some parts of the city and in some at some labs. So now that is about 24 to 48 hours for the most part. And you can actually track this online on our New York City Department of Health website, where we actually post the turnaround times. Additionally, a massive school-based testing effort, which continued throughout the DOE institutions, and as well as many other sites run by H&H. Additionally, beyond the testing, the New York City Test and Trace Corps has done amazing work in providing support for people who test positive in their close contacts. So remember, the Test and Trace Corps reaches out to all positive cases to ensure they can safely separate. Remember, household contact is a really frequent way of transmission. So people being able to safely separate either at their homes or in a free hotel room reduces transmission. So this is a great innovation that came out of the pandemic, as well as individuals getting these great care packages. And, it allows, really, it's great. I have friends who were diagnosed with COVID and they receive these packages, and they include everything from sanitizing wipes to even pulse oximeters, which are the devices you put on your finger to make sure your oxygen level is good. So it's a really great care package. It really targets all of the issues and all of the ways that people with COVID or exposed can stay healthy. Additionally, we've issued guidance to supplement New York State. And every day we are sharing more and more data than before. So again, I will refer you to our excellent New York City Department of Health website, as well as a Test and Trace Corps website that just gives details about this pandemic in a way that's really transparent and easy to understand.
And Demetre, this is Ted, if I could jump in here for a minute. If you take any one thing away from me here today, it's really what's on this slide, which is testing is one of the most important things that we can do. And every time you go and get tested, you're keeping New York City safe. And I'm going to give you some evidence to try to convince you of this. If you were to make up a city that would be at the highest possible risk for being affected by COVID, you'd make up a city where people live in close proximity, multi-generation homes, have a major international airport, you draw out New York City. And in March and April, we saw what COVID can do. We all will never forget the horrors that we experienced in March and April because New York City is so high risk for having COVID take hold and then really run rampant. However, since March and April in New York City, we've driven down the percent of people and the number of new cases by 2/3 since June, since we've really ramped up testing and contact tracing. We've kept it there for 4 months. And I'm not going to sugarcoat it. We're in a precarious position as a city right now. We're seeing a rise in new cases that is very concerning to me, and it's rising at an alarming rate. That said, if unfortunately you look across the rest of the country, they're having an even harder time. And in fact, our percentage positive, which is one of the metrics we use, is actually still one of the lowest ones of any big city in the country, despite the fact that we know what can happen from March and April and knowing how high risk we are. And the reason is what's on this slide here. It's that New Yorkers are, as Demetre said before, following the core for wearing a mask and going out and getting tested. But what you can do to keep New York City safe is nothing new, but keep doing what you're doing. And as Senator Krueger said, we're all tired. But this is the time to do what you've been doing, which is earn New York City being one of the safest places in the country and drive it home, because there's a lot at stake if you don't. Getting tested is one of the most important things you can do. Go out to one of our sites, get tested. We recommend getting tested if you interact with other people every month. And if you do that, you will have moved a long way towards, in all seriousness, saving a lot of New York City lives. So please, this is my entreaty to you. We want to make it easy for you. We have sites across the city. We have rapid testing sites at every airport. We're even doing testing at Penn Station now as well. And if there are places where we're not, that you think your community needs, let us know, and we'd love to open up a site near you. So I just want to really emphasize this is so important, and you deserve credit for having done this so far on keeping New York City safe. But now is the time to double down and keep getting tested. So thanks, Demetre, for letting me jump in there.
Of course, as always, my pleasure. Thank you for that really important message. I will then continue on that road of letting you know how you can help us stop the spread now. So the first is help us sound the alarm. So I think everyone has a network. They have folks that they talk to, whether it's where you worship or where you otherwise interact with people in physical or virtually. But there are a couple of really important messages that we need to magnify. Avoid travel and non-household gatherings for the holidays. So, my background is Greek, and Greeks love to get together. And let me tell you, we're not getting together this year. So I think this is, even though it's part of our culture, and I think Thanksgiving is part of many people's culture, I think it's really important. We can avoid. So, as a lot of people have said, expect to see an increase in cases after the holidays. So if we can make that increase less, fewer people will be hospitalized, fewer people will get sick. And as Dr. Long said, we will be saving lives of New Yorkers. So not having a big gathering on Thanksgiving, though it's sad, a little bit sad and inconvenient, I think at the end of the day, the benefits outweigh the costs in terms of the fact that we'll keep New York City safer and potentially minimize that surge that we could see after the holidays. I think we've talked about the core four already, but it never hurts to say it again, and you may hear it again, and maybe one more time after, but the core four are: stay home if you're sick. If you've tested positive or been in contact with someone who has COVID-19, it's time to stay home. Wear a mask indoors and outdoors. Keep 6 feet apart. Oh, and remember, if you're caroling or doing anything else for the holidays that involves singing, make that 12 feet. Keep a little bit further apart. Wash your hands. Get tested often, even if you don't feel sick. If you test positive, separate from others immediately. And the contact tracers call, it's really important for so many reasons. And again, I think Ted highlighted really well the importance of the resources that are offered to keep people safe. So that call is really a gateway to some really great resources. Additionally, if you need to figure out a way to get into a hotel or need other of the sort of wraparound services, that includes dog walking now, you can call 212 COVID-19, and you will be able to talk to a rep and figure out the best way to get the services required to keep you and your family safe. And then always, even though it does not protect you against COVID, get your flu shot. It's not too late. In fact, it's perfect timing. Go get that flu shot. Pharmacies, H&H, all over the place, your doctor's office, many, many places where you can get it. And it's important because we don't have a vaccine in our hands yet for COVID, but we do have it for the flu. And if we have COVID and the flu at the same time, if we could knock out some cases of flu by giving people vaccine, that's going to mean less interaction with healthcare and potentially reducing the possibility of overwhelming our hospitals. So get that flu shot.
And if I could jump in here again real fast again, as Demetre said, just want to emphasize this. A reason to get tested, you can tell my mantra here is very clear. I'm not trying to be evasive. Getting tested is so important. If you get tested and God forbid you're positive, it doesn't stop there. We will do everything in our power to help to keep you, your family, in New York City safe. So it's not an exaggeration. We'll deliver food to your doorstep. We'll take you to our free hotel with free transportation and free pajamas when you get there. If you can't safely separate at home to keep your family safe, we will for free walk your dog. We will do everything to make this as easy for you as possible. And as further encouragement, one thing that I'm really proud of is that we're reaching right now 90% of every single new case in New York City. So you're not going to be alone. 9 times out of 10, we're able to get a hold of you on the phone right now. And 80% of people, nearly 80% of people that we, of all the new cases across New York City, we're completing our interviews with, and we're offering services like this. So we really, if you do have a positive test, it is not the end of the road. It's actually just the beginning of how we can help you. We want to keep you safe. We'll mail you, as Demetre said, a pulse oximeter so you can monitor yourself at home. We'll check in with you every day. We together can keep New York City safe, but it all starts with getting tested.
Great. Thank you very much.
Thank you both. That was great. So now we do have a bunch of questions that people already fed us in advance. And I also just want to double check. Dr. Long, you have to leave sooner than later. Is that right?
Unfortunately.
Okay, so I'm going to start out with some questions for you, and then we'll
Sure.
throw whatever is left at Demetre when you have to take off. So let's start with the testing questions, okay? Can you clarify the different tests that are being used to monitor the virus, including the antibody test? Because people get confused between the rapid, the regular, the antibody, and maybe they're
Sure. Happy to. So actually, I'll start with a summary statement, which is before I go into the detail, if you want to keep it real simple for yourself, if you come to any of the New York City Health and Hospital sites, we only are doing the anterior nares swab, which is just in the front of your nose, none of the ones where you put the swab all the way back. So if you want to guarantee yourself an easy, quick experience, it's always free, come to one of our sites. That's all you need to take away from this call. But I'll go into more detail now too. So the different types of tests, there's 3 different buckets of them. The first is the what we call PCR, which is the gold standard for seeing if you currently have the virus and are currently infectious. That, again, at our sites, we always do through just the tip of your nose. It's very easy, pain-free, and always free. The next is something called an antigen test, which can give you a result back in a matter of minutes. Those are being rolled out across the city, and we're completing a validation study of that test in our system too, and we'll roll it out when we're sure that it's safe to do so. That test, the advantage is it comes back in a matter of minutes. But if that test result is negative, it is recommended that there is a PCR traditional test sent off along with it to make sure that that result is final for you. The final test is an antibody test. It tells you if your body has seen the virus before, but actually takes a few weeks for your body to develop antibodies. So it doesn't help you to know if you're currently infectious, only if your body has seen it before. So all of that said and all of that boils down to, if you come to one of our sites, we'll give you the traditional PCR test, plus a rapid test, which we have at some of our sites too. It's just in the very front of your nose, and we'll have it be as painless of an experience for you as possible.
So thank you. So a lot of our callers, or sorry, people who ask questions in advance, were on the older side, so 85-year-olds.
Mm-hmm.
And some of them just don't even leave home. Is there a special kind of test they ought to be taking? 2, can they get tests at home? And 3, if they show up at any of these sites, can they at least make sure that they don't have to stand in line a long time?
Great questions. So the answer is, if you're of any age, you should come out and get tested. And you should come with you can bring your family too. We test people of any age at our sites. It's especially important for people that are older that have interacted with other people to get tested too, because we know the coronavirus can be harder and have more of a severe course on people as they get older. So I would definitely encourage you to come out and get tested. If you come to one of our sites, we always look up and down the line to make sure everybody's comfortable. So we will of course make sure that you're comfortable throughout the whole experience. In terms of being at home, if you've been listed as a close contact, so if you've been exposed to somebody, meaning you really should get tested, we will actually mail you a testing kit that you could do at home, and then we'll pick it up from FedEx will pick it up from your home too. We're doing that for all close contacts. So if God forbid you've been in close contact with somebody that was contagious, then we'll get you tested at home to make it as easy for you as possible.
Wow. Okay, that's great to know. And are those rapid type tests that they send to you in the mail, or you deliver, or how does that work?
Those are traditional PCR tests.
Okay.
Those are the gold standard.
Got it. Okay. And we've read over the weekend that there were really long lines at all of the testing sites. And so people are concerned that maybe we just don't have enough, and they're concerned about not wanting to, I don't know, relive the early voting experiences of standing in line for 2 to 4 hours. So do you think that was just because it's pre-Thanksgiving, or is now that's our new normal for waiting in line for tests?
It's a good question. I do think Thanksgiving certainly plays a role here. Although I will say, for anybody on the webinar right now that has come out and gotten tested and had to wait in the line, I want to say thank you. I know nobody wants to wait in line. That's one thing that unites us all, is that all together. But thank you for doing that, because your sacrifice in coming out and if you have had to wait in the line is keeping New York City safe. We do have, at most of our sites, we actually have only modest lines right now. We've had some lines at our rapid testing sites. CityMD also does rapid tests. They've had longer lines associated with that too. So if you come to one of our rapid testing sites, what we're starting to do now is we're going to walk up and down the line. And again, when I said to make sure that you're having a comfortable experience, we're going to offer you a self-swab kit, which we're rolling out soon to be at all of our rapid testing sites. So you can choose to actually do the swab on yourself, exit the line, and we'll call you with the result within 1 to 2 days if you don't want to wait to have the rapid test that day.
And whatever happened with those antibody tests that people were getting? Do we urge people to get those now or not?
We say it's your preference. Antibody tests can be helpful in terms of knowing if your body's seen the virus. The challenge is we can't tell you definitively that that makes you immune, and we can't tell you definitively that you couldn't infect other people. So we say if you want to get an antibody test, we're happy to provide it for you. But importantly, if you do want to get an antibody test, we also want you to get a PCR test to figure out if you're currently contagious. Then we can help you to not infect other New Yorkers, which you would want as well.
Got it. All right, I think these were the testing questions specifically for you. I must admit I hadn't known about the dog walking service. If you're actually diagnosed as being sick, that the city can help you with that as well. Very impressive.
It's all free too, free dog walking.
It's pretty amazing. All right, I'm going to now go to, so here's the global question, and maybe you or the other doctor. I'm just going to call you Demetre because your last name is still a challenge to me. I apologize. So how severe do both of you expect this crisis to become over the next couple of months? Do you have a projection of, even if we're doing all the things we're supposed to do, are we going to go up as high as we were the last time we were at the top? Are we going to go higher than that? Any sense?
Do you want me to take it, Ted, and start, or?
Sure. Yeah.
Yeah. So, so this is where we have to be gambling people a bit in terms of what we think. But I think that we do have a large number of New Yorkers who continue to adhere to the core four. And so what I think, based on what I've seen from the models and the thinking, is that we will probably have a less rapid increase and likely a much lower peak. So I think my guess, and Ted, we can see if we agree, is that it will start a little slower, or maybe substantially slower. As you can actually see that in our numbers. I mean, I think that if we had testing in February, we probably would have seen this. Maybe a bit faster because people weren't masking and we didn't have all the same knowledge that we have about the virus. But I think it's going to be slower. I think the peak is going to be lower. Ted, do you agree with me?
Completely agree. Yeah.
Okay, thank you. All right, and again, thank you, Ted. If you have to slide off whenever, we'll understand, and we appreciate your being here with us today.
Thank you, Senator. Thank you for having me.
Thank you. So, closing of restaurants and essential businesses. I've actually called for the city and state to just go ahead and close down restaurants and non-essential businesses because I am so concerned about, and you laid it out when you were talking about the most common ways to spread the illness, that unfortunately taking off your masks and eating and chewing and spitting and coughing and speaking loudly in bars and restaurants is exactly the type of thing we don't want people to do. And even though I know it's horrible for the economics of restaurants and the people who work at them and who own them, I just think that that's the answer. But then there's this sub-discussion about outdoor dining and what that means, since it is heading towards, December around the corner, and outside dining is now morphing into what I describe as sort of indoor structures that we're putting in parking spaces on our streets. So I wanted to ask you, are there any particular things that you're concerned about with these outdoor structures? I spent the weekend talking to the city government about clarifying that these sites are not supposed to be closed for more than 2 of the 4 sides, and they're not supposed to have more than X number of people in them. But I don't believe there's anybody really monitoring or enforcing this. So as doctors, what do you think about going to sit in these enclosed outdoor dining spaces? And should people actually feel like they're not putting themselves or others at risk?
I was muted, I'm sorry. So I think that it sort of goes along with sort of what we think about harm reduction. So I think if you look at a lot of what we've talked about before in this pandemic, is that, if there's harm elimination, and there's some people who are folks who would avoid all harm. So it's sort of like people and heights. There's some people who are afraid of heights and some people who are bungee jumpers. We should all not be bungee jumpers with COVID-19. We should really work to be more on the side of being a little bit afraid of heights and respectful of the fact that the virus is something that can transmit in certain ways. So I would say that in general, from my perspective, that the more you can sort of do things outdoors, the better it is. So that's easy for all settings, whether it's dining or other. And I think, again, when you look at the setting that you're eating, I think that, from my perspective, purely from a medical stance, a more open outdoor space with heaters is better than a very enclosed space. So I think that is, I think, true for the virus in every direction. That if you have ventilation, if you have distance, those two things really provide you the protection that you're going to get. Of course, going anywhere outside is not 100%. It's not like 100% protection. So I think, really at the end of the day, it's, if you select your venue, really identify the level of risk that you're willing to accept. My advice is accept very little risk and try to stay in places that have open seating, more open environments. I think it's also a fair question to call ahead. I think that you can say, like, what is the outdoor seating like? Is it heated? Is it not heated? What is your structure like? I think people are getting used to answering that question.
Great. I also urge people, remember, you can order in, you can pick up your food, you can have the restaurant experience without having to be in a restaurant. Whether it's the indoor dining now, which I don't think is going to be around that much longer, or the models of outdoor dining. But yes, there are supposed to be at least 50% of the wall space of these outside facilities are supposed to be open to fresh air. And if you walk around my neighborhoods on the Upper East Side, you see full wooden boxes popping up all over. They are clearly in violation. And you can actually call 311 to report someone who you believe is in violation. But use, I think, as the doctor just said, use common sense. This is not a good time to practice bungee jumping of high-risk activities to expose yourself or others to this disease. So thank you for clarifying that. And again, I encourage people, when they go and do food ordering, either delivery or pickup, if you can work directly with the restaurant and not go through one of the online apps, you're saving the restaurant about 20% of the cost, because the online app ends up taking about 20% of the payment. So if you really want to be helping your local restaurant stay in business, yes, order in from them, pick up from them, but just call the phone number of the restaurant and do it that way. So that's my little marketing pitch.
Senator, could I add one more thing about dining?
Please.
I just wanted to also go back to Thanksgiving for 1 second to sort of really drive that home, which is that that is a very special dinner, and that is a wonderful dinner to keep within your household without extra guests. So even if it's takeout from somewhere with delicious Thanksgiving style food or other holiday food, that is another thing I just wanted to drive home, that please, even though we want to gather in that often indoor setting, this is not the year. So
yes, you're absolutely right. And I know my family is going to do a Zoom session while we're all eating at different tables in different states around the country. That's how
we've all become very good at Zoom. So I think that's good. Even here we are.
Here we are. So another opportunity to use Zoom. So what other non-essential businesses do you think it would be smarter to be closing right now? We talked about restaurants and bars. What's your feelings about gyms? Can they be continued open safely? Hair cutting places, nail salons. Again, how, where do they fall on the spectrum of risk?
So, I mean, I think the first is like everyone should stay very closely in tune to what is happening in the city regarding various recommendations for businesses. So just keep your eyes and ears open and peeled. I would say I wish I had a clear answer, except that ultimately the decision is the state's decision. So keep an eye out for the right thing. I again sort of make the comment that just because it's open doesn't mean you have to go. And so if you want to sort of be in a sort of safer zone, then you can think about really minimizing anything extraneous. So in general, the advice of anything that feels kind of extra at this time is probably a little extra. And so you can probably, whether it's open or closed, I think veering toward the side of caution as we're seeing increased case count is probably a good idea.
So you see some people wearing masks plus those plastic, I don't know, they look like beekeepers protection.
The eye shields.
Eye shield. Are we recommending those?
So no, the current guidance is just use face coverings. The eye shields tend to be sort of in sort of the healthcare setting where droplets and aerosols can be made that are more likely to get in your eyes. If you maintain 6 feet distance, you're not going to need them. And also, in general, there's definitely no guidance for public usage of those larger face shields.
Got it. And it sort of goes back to, I guess, the gym question, but just in general. So originally, everybody was told you have to, get those wipes and scrub everything down every 5 seconds so that the germs aren't sitting on your furniture, on your table, on the bags that you're carrying in and out of your house. It seems now there's much less focus on that. Is that because we now know that isn't really how people are transferring the disease to each other?
So much ink has been spilled on this in the scientific literature, for sure.
Yeah.
It's gone back and forth and back and forth. And I think ultimately the statement that the CDC makes is, I think, the best, which is that though it's possible to have a surface that you can transmit from, or you can get, there may be live virus, that it's not the most efficient route of transmission or the most common. And so that's why, rather than necessarily wiping down the entire world, hand hygiene continues to be one of our core 4. So whether that's alcohol-based hand sanitizer or just good old-fashioned soap and water and sing happy birthday a couple times to make sure that you've done it long enough, and don't forget the middle, like in between your fingers and your nails, like a really good hand wash. That's why that recommendation remains as one of our core strategies. But realistically, surfaces are not a common way of transmitting.
And so there were some questions about the safety of getting on buses and subways. And I know that's a state decision, not a city decision, but I just want to double check my facts that I think the emphasis should be on making sure people are wearing masks when they're on the buses and subways, but not actually to be that worried about, do you have enough wipes to wipe off the subway car before you get into it each time?
Yep. I think that is 100% reasonable. So, I think people have to travel, and meaning within the city, and I think transit is a way that works really well. So again, wearing masks and other face coverings at all times on those trains and buses is really important. I remind people of what we used to say back in February and March, like, don't touch your face. I know it's very tempting. I mean, we all do it. Like, it's, touch your eye, touch your face. You bring hand sanitizer in your bag or in your pocket or in your purse. Like, after you get off, give yourself a spritz of alcohol-based hand sanitizer just to be thorough. But I think that using, you don't need to avoid these at the moment.
Great. Thank you. So what do we know about this virus? Can we get it again a second time? Is that a urban myth, or is that true?
So it's, again, lots of ink being spilled on this one for sure. I think that there are cases of reinfection that are documented. It's not super common. And I think the hard part is there is like more and more literature that's coming to light about potentially there being some immunity that lasts for some amount of time. We just don't have the answer definitively to say how long the immunity lasts. So it's, the best policy is, if you've had it before, pretend you can get it again until we know better, because you probably don't want to get it again anyway.
Right. Okay, so I'm looking at just some questions that have come in as we've been chatting, and so some are about when people are when you're talking about not having interactions with others outside of home. People want to know, does that mean like extended transaction with others, or can they go to a supermarket if it's okay and they're wearing a mask, even if they haven't been tested, or they might actually think they might not be feeling great, or are you literally just supposed to lock yourself in your apartment and have no one come near you?
Yeah. So the if you're sick, stay home mantra continues. So and I think it's important to remember that some folks will have mild symptoms, and that if you don't know what's going on, the best answer is to get tested. And so to get tested on some frequency anyway, but especially if you're not feeling well. If you're not feeling well, my advice is only go out for essential services. If you end up testing negative, great, you can put on that mask and do your thing. If you test positive, you will have a dog walker come to your house to take care of your dog if you answer the call from Test and Trace. That I sort of say that with a little tongue in cheek. They do all the other services like food delivery, etc. So really, like, testing is the key. And if you're sick, really minimize any leaving your house until you know what's going on.
Right. Okay, so this is, I think, a very timely question that we're all thinking about. When is that vaccine or the vaccines really going to be available to us? And is there a hierarchy that we should think about people getting it? So for example, sometimes they say that if you're a higher risk person for certain illnesses, maybe you shouldn't be in the first in line to get a vaccine. On the other hand, if you're a higher risk person for catching the virus and being sicker, aren't you supposed to be first in line? Like, what's the priority and how should we think about this whole thing?
So this question came from one of your constituents, which is amazing. What a insightful and complex question. So thank you for that. So, I think we're going to see vaccine land in some form in US areas, including New York City, probably, let me just be generous, sometime, let me be aggressive, in December. I think we may see something land in December. It's important to remember that the vaccine really rolls out with phases, and different people go first. We're still waiting for the federal government to give us an idea of what the prioritization will be, and then the city and state will work very closely together to make sure that that wherever we have ability to nuance it, we nuance it together in the same way, so it's nice and clear to everybody. And so really that's another one to really watch this space, stay tuned. Most likely what will happen is that healthcare workers will go first, because a healthcare worker being immune means less chances of them potentially both getting the virus and also transmitting it to other people in healthcare. So that they're probably going to be number one, and then it'll go from there. And most likely individuals who are higher risk for complications from COVID will be earlier in that list rather than later. Because the virus, before it launches, it will have to go through all the adequate sort of evaluations for safety. And I think the idea really is to protect the most vulnerable. So we don't have the exact prioritization, but we do have people who are on the committee. So that's good news. So I think that's the direction it's going to go.
Got it. And we now know that there's, I think, 3 vaccines that seem to be close to ready for prime time. And there'll probably be more at the rate we're going. And so there might be a variety of different vaccines on the market. Are we supposed to keep track of knowing that we really want vaccine A versus B versus C? Or the assumption will be if it's out there and they're making it available, that's the okay one to take? How do we
Great question. So 2 of them are actually further along, and we can speak about that. And so they both have a very high effectiveness that they've cited around 95%, both of them. And so those 2 are going to be given. They're going to create allocations for each area. So city in our scenario, and then we're going to get those allocations. It won't necessarily, they're going to land initially probably at some hospitals. They're going to be able to give it out. So I think it's going to be come in a very specific way. I feel like we're yet to learn what happens depending on vaccines that may have lower effectiveness, and so I don't have an answer yet. so I think it all depends on what they find in like the full study. So I think that, for instance, I think the vaccine that made news today, there's a different dosing strategy being used in the US than in other parts of the country. So it may end up having a different effectiveness than billed by the in the other parts of the world. So more to come. But the first two, the Pfizer product and the Moderna product, will likely be landing sometime December, January, and we'll have, you know, an adequate amount to do folks who are in that first phase of the prioritization. So we're gonna have a few months together on
Yep.
making sure that people get vaccinated. So it's not going to be one day fingers snapped and everyone gets the vaccine, but all the systems are ready to go once vaccine lands in the jurisdiction.
And have you heard anything about people being told that they might want to take multiple vaccines because each of them are slightly different and cover some different kind of, I mean, I don't-
You're on the edge of science here. I don't have an answer. I don't have an, it's, you know, I think that there's a lot of, you know, if things are 95% protective, then more vaccines may not be necessary. But you do raise an important point, which is that when the vaccines land, at least right now, if you start with vaccine A for dose 1, you have to get vaccine A for dose 2. You can't mix and match.
Right.
So, and we have systems here that will make sure that we can track that in a way to make it easier for people to know where they need to go to get that second dose. So more coming.
Right. That's right. So all the vaccines we know about, it's going to require 2 different doses.
There's one that's like further back. Like I think the Johnson & Johnson product is 1 dose, but we don't know anything about its effectiveness yet. So I think there is one vaccine in the pipeline that may be single dose.
Got it. There's apparently a bunch of studies that show 80% of the people who get COVID are vitamin D lacking. Now, I thought everybody was vitamin D lacking.
Pretty much in New York City, everyone is vitamin D lacking.
We just don't get enough sun.
It's just how it is. I mean, as a doctor who checks people's, I mean, I do HIV medicine and vitamin D is something that we check. And I will say more often than not, everyone is vitamin D deficient. There's no harm in taking normal over-the-counter vitamin D supplementation. I can't tell you it's going to make COVID better, but it may make your mood better. It may make your bones stronger. So there's no reason not to do it.
Okay, thank you.
Yeah,
and
that's
I'm
an easy one.
Told I'm vitamin D deficient, even though I take the supplement.
Yep.
Like I'm trying.
It's just one of those things. And I don't know if work from home helps very much because it means work in with these lovely fluorescent lights. Not that I'm at home, but yeah.
Got it. Okay. Just saying more questions coming in. We have like 2 more minutes. Whatever happened to the theory about gloves? Is there any reason we should be walking around with the rubber gloves?
No. There's hand hygiene is what you should do. So that I'll tell you that that gloves sometimes becomes people's excuse to not necessarily do good hand hygiene. And so you know, gloves are really good in medical settings because you change them a lot and there's hand sanitizer everywhere. But, you know, when I see people who are, which thankfully I think I see it a lot less, people who are on the subway who are just like walking around with gloves, I don't really understand what it's doing except for collecting other bacteria. So I think that the right strategy is bare hands are fine. Just have a hand sanitizer nearby you. You can get like spray on hand sanitizer that's alcohol based, gel based. There's so many options. We're not in the phase where you remember back in March trying to find hand sanitizer was challenging. I feel like there's a lot. And so I think having a little something in your pocket when you go on the subways or buses or other places is a lot better than gloves. And also I'm always very impressed when I see like outdoor dining and they have like hand sanitizer on their tables. It's just, you know, that is something, says the infectious disease doctor, that we shouldn't get rid of when COVID is better. Like this is really good health idea across the board.
Right. So somebody was asking, and I bet the answer is we don't really know yet. Where will I be getting my vaccine when it's available? In a doctor's office, at a government facility? What if I'm living upstate New York instead of New York City? And I'm assuming we're going to try to make it as widely available as humanly possible.
There's going to be lots of different places that this will happen during the different phases of rollout. So some things that are just for healthcare workers may be very focused in very specific settings, but as we get further on the phases, there will be more opportunities to get vaccine. And the good news is at least one of the Pfizer vaccine requires ultra cold storage, which creates some complexity. The Moderna vaccine doesn't. And
Right.
so that's really good news. So I think both, and a lot of, just so people are aware, a lot of your healthcare settings have worked really hard to make sure that they're ready to accept ultra cold vaccine. So I think one way or another, we're gonna have a lot of venues where folks are going to be able to get vaccine. But I'm going to sort of say again, don't expect that first landing of vaccine in December is going to be available all over the place. It's really going to be focused on that essential worker, medical essential worker round one, and then as it expands to phase 1B, 2, 3, it will become more and more available. So I think the goal is eventually, sort of not in a very long time frame, but eventually to have it as available as a flu shot when necessary.
Right. And again, I'm sure we don't know all the answers yet, but I'm just going to tell people, if you know that you have specific illnesses, chronic illnesses, genetic illnesses, etc., you should be just touching base with your healthcare professional who knows you and your history, so that when vaccines are available, if there's any reason to have a different approach because of your history of illness, you'll be talking to someone who actually knows you and knows what's been going on with you, as opposed to, they might be offering vaccines at every drugstore. And if you're perfectly healthy, getting your vaccine at every drugstore might be just fine. But if you know you have unique medical issues, you want to just check with somebody who knows your history. Does that sound logical to you, doctor?
Absolutely.
Because I know that's true with other vaccines, that there are, even though I'm a strong believer in vaccines, that there are certain childhood vaccines that pediatricians say, well, because of X, we don't want to do it this way. We want to do it that way for you, or we want to do it over a longer time period for you. So we're all unique human beings, and we might have different illnesses that require different kinds of treatments and vaccines. So I don't want everybody just thinking, rush out the first day you hear there's something somewhere. Make sure you get all the information you need. Right? So we've actually come to the end timeline. So I want to thank you so much for being with us, and thank Ted Long, who had to leave a little earlier. For people who might not have been at the beginning, you're actually leaving the city of New York very soon for a very important job at the CDC. And so we want to wish you the greatest luck in your continuing career, trying to make sure we all stay healthy and safe. So thank you very much for participating with us. And I want to wish everyone a happy Thanksgiving. Follow the advice we all just listened to today. Right. We're going to have our next town hall Wednesday, December 2nd. It'll be at 6 p.m. And we're going to focus on the mental health impacts of the virus. And we're all suffering from mental health impacts of the virus. Trust me, even if you don't think that's possible, you really are. We all are. So we have that evening, Columbia University psychiatrist, Dr. Lisa Dixon, the director of the Center for Practice Innovations at the New York State Psychiatric Institute, and Doug Rutterman, director of Project Hope at the State Office of Mental Health. Stay safe, wear your mask, social distance, wash your hands, and get yourself tested. Thank you, everyone. Till the next time. Take care.